Hi, I'm making a box opening today of a doll that I'd ordered back a few weeks ago from Claire Taylor Dolls. So I wanted to share this with you. It's a special doll, so I haven't opened up completely the box yet. So it's going to be a surprise. So this is going to be for, this doll's going to be used for doll therapy. So I have paperwork. So I'm going to look at this. A nice card from Claire. And Claire is making dolls with her daughter now and husband. So it's beautiful. So it says, "Thank you for taking home this beautiful baby. May she brings joy to you." Signed, Ali. So Ali's the daughter. She painted and did the rooting. So it's gonna be really beautiful. So what I wanted to say is that the Claire Taylor has been sculpting dolls for years. And she does amazing work. I've followed her with the years. But this is the first time I have a doll directly from her. And she knows I'm into doll therapy. I wrote a book. If you want to go check my website on approcheparlapoupée.ca, I'll leave it down in the comments. So I send her a book. I sent it to her and to Ali, if they're probably going to read it. So it's really nice, you know, these dolls. I make dolls. I'm a reborn doll artist myself, and I make dolls. I've been making dolls for since 2013. So, but I don't do silicone dolls. So let's see. Wow, this is a beautiful packaging. Wow, Claire, this is so beautiful. So she put the clothing. So let me see if I can show you these items she put for this doll. It's a girl. For me, she's gonna be always dressed as a girl. She's a cuddle baby. So people that follow me knows that I've been making a lot of cuddle baby dolls, vinyl dolls for long-term care facilities for doll therapy, and also for children. So I have a nice set here, beautiful, with the little matching pants. So with the pictures, Claire did send me some pictures. She always likes us to see our dolls first. And she was amazing just in the pictures, so I can't imagine in person. This doll means a lot to me, so I'll be using her for the expositions that I'll be making as a founder of doll therapy in Quebec, Canada, but also for the nursing convention that's coming out it's coming soon in December. So that's a little jacket, so cute. And she put a bottle here, so I'll see about that. I like to use that for patients, especially with dementia care, the special units with the resident having Alzheimer's. This doll for sure, I'll be using it for myself, for them, but it's not, I don't recommend silicone dolls for long-term care facilities or homes, but maybe for like CLSCs, people that are mourning a child, for example, a passing of a baby. These dolls are very good for that, and maybe for adults for other purposes. But otherwise, I think but Claire has vinyl dolls also, kits for sale. So she put diapers here and a little pacifier. This doll can take a full passage. So let's see. So I've been waiting a long time to get a doll directly from her. So I'm sure she's gonna be beautiful for sure. Claire is wonderful, wonderful work. She's been doing that for so many years. She does full body silicones also, which of course for doll therapy is difficult because the weight the weight of those dolls are like 8 pounds, 9 pounds, sometimes up to 10 pounds. So they're more for collectors, for doll collectors. So I asked Claire, because this doll is for doll therapy. So I asked her to make her weight maybe like 6 pounds. So we'll see, because the residents, the patients, they can't handle and hold the doll for so long, you know, like 8-10 pounds is going to be too heavy. They have arthritis, they can't be holding the baby that long, and not at all. So this one is the partial, because she's going to have hands and feet, which my dolls, my reborn dolls, the cuddle dolls that I make, have the whole body's cloth. Oh, this is so cute. So you can see the name here. So this is the Jelly Bean model, her cuddle doll model. So if you go on her site, you'll be able to let me sit down here. On the site, you'll see that there's a lot of choices. So I'm gonna start with classical ball box box opening of dolls. They usually start with the feet, so why not? Oh, this is really cute. Claire is amazing. Wow, look at that foot. The foot is so cute. You can see the veins, the blushing, the little toes. Wow, Ali is really great. It's perfect. Very, very, very cute. Let's see the other foot. So she calls them cuddle dolls, but they're more like quarter feet, quarter arm. This is really cute. You can see both feet. So it's the realism that's beautiful. So for me, when I'll go for the conventions and I'll show this doll to other nurses, doctors, any medical care workers, they're gonna be really amazed. And it's more understandable for them when they realize that, okay, when we come with a doll, a reborn doll that's very, very realistic, then they see how come the patient is really having the reaction of a surprise. So I think it's a good indicator, and it's a good example for the staff, caregiving staff. Wow, look at those hands. Oh, Claire, your sculpting is so beautiful. So I have to show you the hands. She's really perfect. So you can see delicate veining, the blushing, and the nails, just like freshly cut newborn. And the hands are very, very realistic. So she's pretty, and she's not that heavy. So that was what I ordered. So thank you, Claire. She's beautiful. She's great. Wow, I couldn't wish for better than this. So now the head, she packed the head very well. So let's see if I can just open it like this. Okay. Oh, she's beautiful. Look at that. My God. Claire, she's wonderful. Look at the hair. The hair it's perfect. The crowning. And look at this little baby. So this is clairetailordolls.com. You can go check her work. she's well known around the world, and this is why, because the realism is just 100%. So wow, very cute. She's perfect. I'm really in awe. Look at the mouth too, if you can see inside. It's very open. So, but I chose a closed eye baby. I could have chose open eye. Maybe the next one I'll see. I'll get an open eye. So it takes the pacifier very easy. But like I say, I don't suggest these accessories for long-term care facilities with dementia care patients, because it's small parts, and these special units, we don't usually put accessories like that, and no pacifiers that has magnets either, because then it could be, maybe has interference with pacemakers. So in my training, I do offer training for the staff. So I like to specify these, the small objects, not too heavy dolls, easy to dress clothing for the activities. Usually when I send a doll out, oh, she's cute. When I send a Venal doll out, I put a user guide. I have a user guide with the doll. So you got all the information on the site and what to do, what activities you can do, for what is the purpose of doll therapy with patients. You know, like we know that it diminishes anxiety, and it does bring joy and comfort. And we can also use the dolls to do some nursing intervention, like if you have a blood test, for example, to do, and the patient is stressed out or doesn't cooperate, you can ask somebody, an orderly or another nurse, to come with the doll and do a diversion, so then you can do your blood work. Or sometimes they're giving out medication, and the patient can have a reborn doll while he's busy, instead of going in the rooms and wondering. And so doll therapy is great. It's really growing fast, and a lot, and fast here in Quebec, Canada. I have dolls all over Canada now, and with the CDS company that is helping out there and putting doll therapy in other provinces than Quebec. So I'm really proud of that. But this doll is means the world to me. She's amazing. Thank you, Claire. I can't say how much I can thank you, and Ali and your husband too. I know the three of you work very hard for the company. So it's great work. Really nice. So I'm really happy. I'm happy I could show you I could show you this little one. I didn't put a name for her yet. I'll see. Maybe I'll ask my two children. I have Sarah and Sasha. I have one girl, one boy. They're adults now. We're talking about 36 years old and 30 years old. My son has two children, so I have a granddaughter. So I'll see what Grandmama is gonna name her. And this doll is gonna be stunning for my convention coming in December. I have a few exposition that I'll be making for nursing, so I'll see that. So for the benefits too of the doll therapy, it could decrease also the using of the antipsychotic medication like Valium or other kind of medication. So it's doll therapy is really it's going to be as big as a animal assisted therapy. I always say zootherapy, but it's a more French term. But definitely doll therapy is growing very fast. So if you like to visit my website, I'm gonna put the link for Claire Taylor dolls. I think I have it in the paperwork, but I think it's just .com. So you can go visit her site. And she does have payment plans because these dolls are very special. But it's worth waiting a year or 6 months for the plan. So why not? And on Amazon, I do have a book there on doll therapy, the book I showed you at the beginning. But it's not up in English yet. It's in Kindle format, but I'm gonna work on this next week and see with Amazon. But anytime, if you like to have a paperback book, I could just send it. You can buy it directly from me. So that's it. Beautiful. Thank you so much, Claire. Adorable. She's really, really pretty. Looks like a real newborn. Thank you so much for everything, Claire, for all your work. Thank you, you guys. If you like to subscribe to my channel, I'm going to be making some videos for, let's say, I'll give you some examples of all the activities we could do that I do have in my booklet, in the book also, because there is things that to say, what we should say, what we shouldn't say, what we can do, what's better with the elderly, or if you want to do doll therapy in your classroom with children. It's also very important, and it's nice. I think it's a beautiful topic. So if you subscribe, I'll just keep in touch. So thank you for being there.